Hi, my name is Rio Calvert and I'm a nurse practitioner in Orange County, California. I've been in aesthetics for 15 years and I've been doing thread lifts for 5 years. It is a game changer for my patients, and today we're going to be discussing threads. Okay, so there's two types of threads. There's barbed threads, which are the lifting threads, and then there's monofilament threads, which are also called smooth threads. Today we're only discussing smooth threads. Now the smooth threads are much easier to insert and they are don't require as much skill. The barbed threads are a little bit more complicated, does require a little bit more technique, but today we're going to be discussing smooth threads and the purpose of smooth threads and where we can use them. Inserting mono threads are very easy. They're basically these little hair-like sutures on a needle, and you're just going to place it underneath the skin. Doesn't take virtually any time at all. There's very little downtime, and there's very little risk. It basically is a suture. Sutures have been around for a very long time, and your body absorbs them over time, breaks it down to simple sugar. Within the mono thread family, you have smooth mono threads, and then you also have twisted mono threads. Both of these have a fantastic ROI. Basically, how you want to figure out your profit margin is look and see how many threads are you going to use, and then maybe double or triple what you will charge a patient for it. Mono threads are easy to integrate with other modalities in your practice. They will work synergistically with your IPL, with your microneedling RF. They'll actually work together to help stimulate collagen and get a longer lasting, better outcome. Okay, so this is a basic setup of your tray. We want to have a clean environment. It doesn't have to be sterile, but we want it as clean as possible. We want to have some kind of an antiseptic, whatever it is that you use in your practice. This is Hibiclens and some alcohol, some non-woven gauze. I have a tongue depressor here to apply the topical numbing. This is a 1 ml syringe with a 32 gauge needle on it. This has straight Lido with epi, and that's going to be used to make my entry point with my introducer. I have an 18 gauge needle here, which will make my port. White eyeliner, or you can use markers to create the lines and the vectors that you're going to use to insert the threads. And then I have the threads I'm going to use for the procedure. A tip here is to go ahead and pre-release this cap so that they're easier to grab and insert into the tissue once you're ready to begin. So I go ahead and I release all these prior to the treatment. Okay, so we have applied topical numbing to our patient here. We're going to go ahead and leave the numbing on her décolleté because we're going to save that for last. And now we're going to do a facial assessment. What bothers this patient is the under eye hollows, her nasolabial fold, her marionettes, pre-gel sulcus, and the preauricular area. We're going to be using a multi-specialty thread in the nasolabial folds, marionettes, and the pre-gel sulcus and the preauricular area. And then under the eyes, we're going to be using a blunt tip thread for the under eye hollows. What this means is we're going to make maybe 1 or 2 entry points per area and be able to put multiple threads through each hole as opposed to having multiple holes put into the patient's skin. Prior to numbing the area, we need to measure where we want to begin inserting our thread. So what I've done is I've determined where I want my thread to end, and I need to make my injection with lidocaine right at the base where I want to insert so that it will end up in her nasolabial fold. Same with the preauricular area. I want my entry point to be back here so that I can have the bulk of the thread be where she has the most volume loss.